My name is Pilane and I'll be facilitating today's session. This is the first of our three-part webinar series where today we'll be discussing access to medicines and treatment during COVID-19 global pandemic. I'd like to introduce Mr. Christoph Platter, who's the Director of CAS Media Program Sub-Sahara Africa, to say a few words for us.
Good afternoon, dear colleagues from all over the continent. If I look at the list as to from where participants are joining us, I'm delighted, because this shows that this regional program, CAS Media, is truly trying to bring people together.
Thank you so much, Christoph, for that important introduction to why we're here today. And without further ado, I'd just like to hand over to Fatima, who is going to give us a keynote as she discusses the protests, the politics, and patents. Fatima, over to you.
Access requires political will and affordability. And in this context, both are heavily influenced by those who hold the intellectual property rights to these potential life-saving advances. In other words, the patent holders. If we reimagine the patent and IP global order and system, access for the most vulnerable and the most at risk of ill health has to become a key feature of that system. In a public health crisis, exclusivity must be replaced with equitable access and the opening up of science. Otherwise, patents will only drive innovation, and that innovation will continue to mainly benefit the wealthy and the powerful.
We have a constitution that guarantees the right to access healthcare services. And the courts in South Africa have said that that right does include access to affordable medicines as well. And it's important, I think, for media people and civil society to really inform themselves about these legal frameworks, the kind of innovation that we actually need in African countries, that would get us better drugs for malaria and see more rapid responses to addressing TB, which is one of the largest killers of people in South Africa, at least. In South Africa, we know we have a small generic manufacturing capacity. We need to have an industrial policy that actually encourages the development of that industry so that we are not constantly reliant on the manufacturing and innovation that happens around the world. We need to find out what in our own countries we can do to push for a better framework for greater access.
We need to demand a different level of transparency and accountability of these companies, and the relationship between drug companies and governments or don't have a strong and independent media. When we talk about vaccine nationalism, and the key issue and the key debate with this vaccine nationalism agenda is how do you ensure in a time of COVID, in this pandemic, globally equitable access to a vaccine that is affordable for those patients and those countries that need it the most. The whole social relief package, I think, was ignored, and it was not given sufficient attention to, which made the impact of the pandemic, which made the impact of COVID, I think, worse. We need correct information. As journalists, particularly, your role also is to explain to people, because there is so much of fear.
When we look at the quality of journalism that we're producing, make sure that we are providing our constituencies or our stakeholders as journalists, which is every single body who reads us or who listens to us on the radio, with the correct information.